Welcome to our exploration of the economics of healthcare. In this video, we'll break down how supply and demand shape the medical market, influencing everything from the price of services to the availability of care. Understanding these economic principles is crucial for anyone interested in how healthcare systems function, whether you're a patient, provider, or policymaker. We'll start by defining the basics, then move on to real-world examples and challenges unique to healthcare. By the end, you'll have a clearer picture of why healthcare markets behave differently from other industries and what that means for all of us. Supply in healthcare refers to the availability of medical resources such as doctors, nurses, hospitals, and equipment. Unlike other markets, increasing supply in healthcare isn't as simple as producing more goods. Training medical professionals takes years, and building hospitals requires significant investment. This limited supply can lead to higher costs and longer wait times for patients. We'll look at how these constraints impact the overall healthcare system and why simply increasing supply isn't always feasible or effective. Demand in healthcare is driven by the need for medical services, which can fluctuate based on factors like population age, disease outbreaks, and public awareness. Unlike other goods, people often seek healthcare out of necessity rather than choice. This means demand can be unpredictable and sometimes inelastic. Patients need care regardless of price. We'll explore how these unique aspects of demand influence the way healthcare services are provided and financed. In most markets, prices adjust to balance supply and demand. However, in healthcare, prices are often set by insurance companies, governments, or negotiated contracts. This can lead to situations where prices don't reflect the true cost or value of services. We'll discuss how these price mechanisms work and why they sometimes result in inefficiencies or disparities in access to care. Insurance plays a major role in the healthcare market by pooling risk and spreading costs among many people. This allows individuals to access expensive treatments they might not otherwise afford. However, insurance can also distort the usual supply and demand relationship, since patients may not see the full cost of care. We'll look at how insurance affects both providers and patients and the challenges it introduces to the market. Healthcare markets often experience failures that prevent efficient outcomes. These include information asymmetry, where patients and providers have unequal knowledge, and externalities, where individual health choices affect others. We'll explain these concepts and show how they lead to issues like overuse or underuse of services and why government intervention is sometimes necessary. In healthcare, patients often rely on providers for information about diagnoses and treatments. This imbalance, known as information asymmetry, can lead to problems like unnecessary procedures or higher costs. Providers may recommend more services than needed, or patients may struggle to make informed choices. We'll discuss how transparency and regulation aim to address these challenges. Externalities occur when the actions of one person affect others. In healthcare, vaccination is a classic example. When more people are vaccinated, everyone benefits from reduced disease spread. However, if too few participate, outbreaks can occur. We'll explore how positive and negative externalities shape healthcare policy and why collective action is important. Entering the healthcare market isn't easy. Strict regulations, high training requirements, and significant capital investments create barriers for new providers. These barriers help ensure quality but can also limit competition and innovation. We'll examine how these factors influence the structure of the healthcare industry and the availability of services. Governments often step in to correct market failures and ensure access to essential healthcare services. This can include funding public hospitals, regulating prices, or providing insurance programs like Medicare and Medicaid. We'll discuss the pros and cons of government involvement and how it shapes the healthcare landscape. Some aspects of healthcare, like disease prevention and emergency response, are considered public goods. These services benefit everyone regardless of who pays. We'll explore why markets alone may not provide enough of these goods and how public funding helps fill the gap. Advances in technology have transformed healthcare from electronic records to telemedicine. These innovations can increase supply, improve efficiency, and lower costs. However, they also introduce new challenges such as data privacy and unequal access. We'll look at how technology is reshaping the healthcare market. To keep healthcare affordable, many countries use price controls and regulations. These can include setting maximum prices for drugs or limiting what providers can charge. While these measures can improve access, they may also lead to shortages or reduced innovation. We'll weigh the benefits and drawbacks of price regulation in healthcare. In some areas, a single hospital or provider may dominate the market, creating a monopoly. This can lead to higher prices and less choice for patients. Encouraging competition can improve quality and lower costs, but it's not always easy in healthcare. We'll discuss the balance between monopoly power and healthy competition. Elasticity measures how sensitive demand is to price changes. In healthcare, demand is often inelastic. People need care regardless of cost. This can lead to higher spending and challenges in controlling costs. We'll explain why elasticity matters and how it affects healthcare policy. Moral hazard occurs when people take more risks because they don't bear the full cost of their actions. In healthcare, insurance can lead to overuse of services since patients pay less out of pocket. We'll look at how moral hazard affects costs and what insurers do to manage it. Adverse selection happens when people with higher health risks are more likely to buy insurance, driving up costs for everyone. Insurers use strategies like risk assessment and mandatory coverage to address this issue. We'll explain how adverse selection works and its impact on the healthcare market. Healthcare spending has been rising globally, driven by factors like aging populations, new technologies, and higher expectations. We'll examine the main drivers of spending growth and what they mean for the sustainability of healthcare systems. Many countries provide universal healthcare, ensuring access for all citizens. These systems use different models from single-payer to mixed public-private approaches. We'll compare how universal systems manage supply, demand, and costs and what lessons they offer. Healthcare can be delivered by both private and public providers. Each has strengths and weaknesses. Private providers may offer more innovation and choice while public providers focus on equity and access. We'll discuss how the mix of providers affects the market. Pharmaceuticals are a major part of healthcare spending. Developing new drugs is costly and risky, leading to high prices and patent protections. We'll look at how the pharmaceutical market operates and the challenges of balancing innovation with affordability. Investing in preventive care like vaccinations and screenings can reduce the need for expensive treatments later. However, markets often focus on curative care, which is more profitable. We'll explore why preventive care is underprovided and how policy can encourage it. A skilled workforce is essential for quality healthcare. Shortages of doctors, nurses, and other professionals can limit supply and increase costs. We'll discuss the factors behind workforce shortages and potential solutions such as training programs and immigration. Not everyone has equal access to healthcare. Factors like income, location, and insurance status can create disparities. We'll examine the causes of inequity and how policies aim to ensure fair access for all. Quality is a key concern in healthcare. High-quality care improves outcomes, but measuring and ensuring quality can be challenging. We'll look at how quality is assessed and the incentives for providers to deliver better care. Healthcare markets vary widely around the world. Differences in culture, policy, and resources create unique challenges and opportunities. We'll compare healthcare systems in different countries and what they can learn from each other. Patients are at the center of the healthcare market. Their choices, experiences, and satisfaction drive demand and influence provider behavior. We'll explore how patient preferences shape the market and the importance of patient-centered care. The healthcare market is constantly evolving. Trends like personalized medicine, digital health, and value-based care are reshaping supply and demand. We'll look ahead at what the future may hold for healthcare economics and how stakeholders can prepare. Economic principles guide healthcare policy decisions. Balancing efficiency, equity, and quality requires careful consideration of supply and demand. We'll discuss how policymakers use economic tools to design better healthcare systems. We've covered the key economic forces shaping the healthcare market, from supply and demand to insurance, regulation, and innovation. Understanding these concepts helps us make sense of the challenges and opportunities in healthcare today. As the market continues to evolve, staying informed about these economic principles will be essential for everyone involved in healthcare.